How old were you when you started to get these?
Gosh, junior high.
Junior high, okay.
Yeah.
Okay. And they just start coming up really mainly here, and a little, you have like a little bump under here, right there, and then on your chest too, or on your abdomen. That we use for Botox is so small that sorry, a little paper pinch here, that you can't really replace the needle hub. You have to use the whole syringe.
Oh, is it like the short needle too?
Yeah, they're pretty short. Well, I think they're this short. They're half inch.
Okay.
But you can't replace the you can't take it on and off. So
okay.
it's like the kind. I think it's a insulin syringe. So a little bit pinch. You probably won't feel this bone right here. That's that blue one up there. Let's see if we can see what this is here now. I'm curious. Sometimes when we do those vellus hair cysts, they're deeper too. That one's already proven it might be a little bit deeper. So have you ever had any doctor squeezes out before? Or they all been ones that you've squeezed out?
Just ones that I've squeezed. I used to have, or I had a cyst on the side of my right thigh, but I went to the surgeon and he removed
Oh,
that.
I see, okay. Did he just numbed it up and pulled and did it under local anesthesia?
No, he put me under because we weren't sure what it was.
Oh, I see. It was pretty big?
Mm-hmm.
Wow. I think these are those vellus hair cysts. Isn't this reminding you, Christy?
Mm-hmm. Yeah.
Right? If you see one pop out, we can actually look at it under the microscope and we can show you. If we can get this darn thing out. I see it under there. You see a little bluish coloration, but it's like...
Yeah, they're deep.
You right? Okay. So you know what I'm talking about too. We're trying to do the least amount of trauma to you as possible, but anytime we push on you, especially being Asian and having darker complexion like this, we tend to pigment. Yeah, look, there it is. I see it right there. There is a darker little hair almost in there. You're right, look, it looks like a little hair there. See? Look, that's hair right there. Huh? I think so. Look, take a look at this too, sweetie.
Oh, yeah.
See that?
Yeah,
I'm gonna
that's
save
how
that so we can look at it.
Mm-hmm.
Am I weird? Saving my little
I do too. I like
treasures.
I do too, and I like taking pictures and send to my girlfriends.
Look what I found.
Yeah.
Do you?
Oh
So they
my
like
gosh.
it too. That's so funny. You share pictures. You snap them so they only last 24 hours. There's still something in there actually. Alright, look, I'm gonna use my new pickups, Christy.
I feel like those are perfect for stuff
I know, I hope so. We're trying to find the perfect ones. And the see, like that's kind of, this is all reminding me of that. But we'll see, she has like a little whitish, I think that's just fibrous tissue right there, so that should absorb. But again, I'm trying not to traumatize her too much here. Her skin, that is, not her.
Mm-hmm.
Okay, I'm gonna put a little pinch right here. I think you're numb here. You okay there?
Mm-hmm.
This one looks like it's gonna come out easily though. See, that looks like steatocystoma. Look, there's a hair or something, see? There's something dark right there. Not sure if it is a hair or not. This is the one that came out over there. It's like more of a, or it looks like that's what steatocystoma look like. That kind of greasy-ish more. And there's a little dark spot in it. Maybe that is a hair. Interesting, huh? You're fascinating, you see?
When we found you, and then I was like sending photos to my girlfriend, she's like, maybe you found your calling, Jen. Like, this is it.
This was meant to be. And we weren't that far from each other either, huh? So you've been waiting. I'm surprised you didn't bring any of these girlfriends with you.
They're all working. I had to take the day off.
Yeah, these are like the steatocystoma like we just saw the other day. It's interesting. I feel like because of this internet phenomenon, we're getting all these patients that have this, and it's sort of a little known, lesser known kind of entity. And look, there's a little dark spot in there. See that dark? right there. But hers are a little different. They have like a little dark something in there. I saw that just now. Like there's a hair that hair's on the surface. You're okay, right? I'm pushing against you. Okay, sitting up. Okay. Just now I saw something dark, but I don't spot it anymore. So we want these all to kind of stay nice and slim like this. Okay, so let me see. All right, well, you got a few of them, so now we're gonna have to think about what we're gonna do here in terms of treating you in all these areas. So I'm gonna just keep going right now, and then if we start to run a little behind, we're gonna start talk about. Let's switch back to this one. We're numbing here. But what we're gonna do, how we're prioritizing here. I'm gonna do.
Yeah, there's like some big juicy ones.
Yeah. We're gonna do some on your tummy, and I want to prioritize. But are you okay with us doing most on your back first?
Yes.
Okay. You're okay with me giving you a little pinch here, right? I'm just gonna pinch you underneath here. Sorry, because I want to numb the surface of the skin up so it won't hurt so much when I push on you. Pinch here. So there's a woman, an African American woman who has steatocystoma that we've treated. And then there's a Hispanic woman who has it as eruptive vellus hair cyst. One of each. So far, one of them looked like a hair cyst, and one of them looked like a steatocystoma. Could you have both going on?
Is that possible?
Perhaps. I mean, I guess anything's possible, but probably. And there might be a syndrome associated with like two of these. But does anyone else in your family have any of this?
No. I think my dad has like milia on his face, but.
See these here, if you look at that, that's like a hair or something might be your mouth. I feel like sometimes this can run in the family sometimes, and I know all these on the back, if you could have reached them, you would have gotten these. I think this is why you have the bigger ones back here, because you can't reach them. Nobody in you didn't trust your friends to do it either, huh?
We tried, but it's not the same. Like, you need to like.
You need to numb it and everything too. It's hard for friends to do that. Like they're torturing you. And for you too to sit still. God, if it was like a boyfriend or husband, you'd be yelling at them.
Oh my gosh.
No, you're doing it wrong. That's what I would do. You see this, Christy? Do you just live through this, or do you wish you could? Look at that hair. Look. That's fascinating to me. Look, I'm going to show you. I don't know, I think.
Oh my gosh.
Is that? Yeah, look.
Yes.
Look at that too. Do you see that?
Yeah.
Look at those 3, 5, like this.
That's how it came out in my stomach too.
Wow. You are cool. Look at that. That's amazing. Do we have any of that dermal blonde, do you think? Do we still have dermal blonde?
I think we do. I can go on.
Well, yeah, I think, maybe, and it wouldn't hurt anything to just like kind of go seal these.
Yeah.
A little, just giving them a little extra, or maybe even like if you had a steri strip, just putting them across it. Yeah. Just to give it a little oomph, Sorry, this is like the little sac it's in. Are you okay here? I'm gonna pull this off and then delicately, good. And then we're gonna send that in, I think. See if we got anything from that. I've got a snip from you too, darn it.
I will get one.
Yeah, let's do that while I know. I want to see how these heal too. I want them to, come out of this with a better response than all of them have a little something gray in them. Look at that. Fascinating. Oh, there's a hair right there. There's some hairs. Maybe they are just eruptive vellus hair cysts, huh? What do you think, Christy? It's like you're my little Johnny Carson, his sidekick, the person I have to talk to. I keep asking her opinion. She's probably like, I don't know. Just don't ask me.
They look different than the last ones,
Yeah.
like than the ones I've seen before. They look,
I
the
don't
last
like
ones were more
them.
seedy
Yeah.
looking.
See, I don't think you happened to be with me when I did the woman. Yeah, and I just did one the other day too, and so I don't think you've seen that. But I bet you if Valerie were in here, this would remind her very much of this last person we saw recently. They're like almost like a greasier, you know?
Yeah.
They're like oily. Look, there's a hair right there. See that hair?
Those suckers out.
What the heck? Look at that hair right there. Oh yeah, you need to put those glasses on, girl, and check that out. Look at that. Those hairs there. There's one I missed right here. Let's get this one better. There we go. It's sort of like gray. It almost looks like a little design, but then when you look closely, it's a little hair. We're gonna go look at that under the microscope.
Oh yeah.
We're gonna
it's
geek
like,
out
it
with
looks
you.
like curved, right? Yeah.
They're very, very fine, which is like a vellus hair, the hair that grows like on our cheek, you know, like or on babies, the downy hair on their backs, right? Like your little baby has like a little fuzzy, the vellus hair. Those are called vellus hairs. Lanugo, they're also called. Oh my gosh, this one keeps going. I keep thinking I'm done with it, but there it comes. So in the past, when you'd be able to squeeze things out, did it come back or did it pretty much go away?
Pretty much went away. There were some that came back.
But more of them, most of them went away. Okay, so that's a good sign.
It's like as soon as I got the hair out, it healed.
Really?
If not, it just kept like filling and filling. And then I keep picking at it, and that's why some of my scars look bigger than what they
I
should.
see. So actually those were from repeated picking. Okay, so let's just try to make sure we get a hair on each one here. Try to get the hair and then we'll be good. Okay.
It's so satisfying when I like squeeze it. Like this is like the 5th time I do it after a hot shower, and then the hair comes out. I'm like, yes.
I bet you wish you were doing all of these.
Yes.
At least you'll be able to watch it. See a hair in that one yet. There's a little, there it is. See, there's the hair. I need to get Christy to start doing this with me. I wonder if she's ever, are you kind of tempted or you feel it's fine to just watch it?
Oh
Probably
no,
like
I'm
living
totally
through it is
tempted.
fine. You are?
Oh yeah.
You can try me.
Yeah, I know.
I don't mind.
Anyone know, do you know Nikki from Nikki Tutorials? Do you know her she's a beauty blogger? Oh, we need to find a mutual fan because I think that person will let her squeeze something. You know how excited she is?
If I had something, I would be that mutual fan.
That person?
I would be that person.
We're almost done back here. There's a couple little blue ones here. Let's see if we can't get them and the hair that I know now is in there. I know I numbed it, but she's just, I can tell she's tough too. Doesn't even match with this. Okay. There we go. There's a little hair. You know, we've done a ton of them where we don't even care so much about keeping it, just putting it on the plate, on the table there. I'm like, I've seen it already.
Yeah,
You have a bunch of them.
I have too many. It's okay.
There's hair right there. Look, there's that hair right there. I saw a little fine one there. There's another one there. Put that out. That one was pretty cool, and I like it because it got it. Oh, look, another little little one there. You got it out of this teeny tiny hole, but now I'm thinking, are there other little hairs in there? Pretty good. Pretty good. Okay, one more. Oh, that one. Wait, that was in my. Talking to him, sorry. In this zone here. Okay, I think we got a majority, and what I'm gonna do is we're gonna take a little bit, and we'll take a little, like, we'll pinch them together, you know, just, and we'll either stir strip or take a little bit of tape, just to kind of give it a little added measure of just making sure as minimized as possible. And then, how should we do this now? Should we put a little piece of, can we just tape a little piece of gauze on her back?
Yeah,
Let's
yeah.
do that.